Kenya has continued in its efforts to uplift the standards of its citizens and provide basic rights to all. And one of these rights is the right to good health. And although the country has made strides in this regard, public health continues to be a concern, particularly among the low-income segments of the population and even more so among children. One of the biggest threats to the health of children is a highly infectious disease, measles. Measles mainly affects children below the age of 5 years old. Perhaps the most worrying statistic is that measles is the leading cause of death among vaccine-preventable diseases. All of these factors presented a clear and urgent need for a deliberate response towards a lasting solution. An appeal was made through past international director and GMT leader Lion Manoj Shah to the Lions Club's International Foundation for Assistance. The Lions Clubs International Foundation, in partnership with the Lions Clubs of Kenya District 411A, gave $1.1 million to this worthwhile campaign. In November 2012, the Lions Clubs International Foundation, in conjunction with the government and other partners, embarked on an ambitious project, the National Measles Vaccination Campaign. The vaccination campaign was planned to run from 3rd to the 7th of November 2012. The vaccination drive was to be offered free of charge to all children aged between 9 months to 5 years old. This was the first measles vaccination campaign to be offered free of charge. The Lions met the other partners and sponsors at the Ministry of Health offices to plan and coordinate accordingly. For the initiative to be successful, there was need for a substantial nationwide sensitization campaign. The Lions took up the task and rolled out a massive and elaborate public awareness program. The Lions Measles publicity campaign was done through various fora. There were flyers, posters, t-shirts, caps, and banners. The Lions team further advertised through newspapers, radio, and television advertisements. To top it off, the Lions team organized a national roadshow campaign intended to move throughout the country. The Lions Clubs kicked off the national roadshow from the city of Mombasa. The roadshow moved from city to city, town to town, village to village, nationally. After the publicity campaign, the Lions were taken through an elaborate training where they got to learn more about the disease and the vaccination campaign. The training was facilitated by senior government health officials.
Ladies and gentlemen, on behalf of the Lions Clubs International Foundation, I hereby officially inaugurate the Lions Measles vaccination program here in this great country of Kenya.
This was followed by a press briefing the day preceding the launch of the campaign.
We have people who are susceptible therefore to measles accumulating over time.
We are referred to as SIS, which is a supplementary immunization activity, to give children a second opportunity to receive measles vaccination.
To date, it is estimated that 1.3 million children under the age of 5 in Kenya are at risk of contracting measles disease. And should an outbreak occur, this will be a major health disaster.
This campaign is a manifestation that there is growing and clear commitment to actually hasten the reduction of child mortality in this country.
The initiative was integrated with vitamin A supplementation and in northeastern areas polio vaccine. The national measles vaccination campaign was finally launched in Ongata Rongai, Nairobi.
It is a great pleasure for me to be here and witness on behalf of the United Nations family in Kenya, and more specifically on behalf of WHO and UNICEF, one more important activity towards strengthening our efforts on child survival in our country, Kenya.
My ministry, through the Division of Vaccines and Immunization, and with support from development partners, plans to conduct a measles vaccination campaign targeting all children aged between 9 months and 5 years. The campaigns offers a second opportunity to protect our children from measles.
The campaign was targeted at vaccinating 6 million children aged between 9 months and 5 years old. In Nairobi, the Lions participated at various health centers across the city. In the rural areas, the team participated at the Nunguni Health Center in Machakos and other areas across the country.
We as Lions, we want to reach everyone who cannot be reached by any other means, because we have been losing many children from measles attack. And our aim as Lion is to make sure that we have reduced the number of deaths which come as a result of measles.
The Lions went a step further and donated biscuits, sweets, and sodas to the children. During the campaign, the team encountered live cases of measles infection. The whole campaign was a resounding success. More than 6.1 million children were vaccinated. The campaign had surpassed its target.
We want to take this opportunity to thank the government and also the Lions Club for giving us this chance as Kenyan women and also young mothers to be vaccinated against the measles.
Na nashukuru hii Lions Club na the government of Kenya kwa kuletea hii chanjo. Wanafanya hii chanjo haraka, watoto wanasaidika, na wahimiza wazazi walete watoto wapate hii chanjo.
The Lions of Kenya have been participating in advocacy and social mobilization for the last 2 months and have actually participated actively in the actual vaccination days in the last few days.
I'm here at the Kibera Health Clinic, where we have vaccinated more than 400 children since morning. It's been a very exciting time for the last 5 days, especially for the Lions of Kenya to participate in the biggest ever measles vaccination campaign that has ever taken place in the country of Kenya. we have been able to mobilize resources, our Lions members and many health workers to more than 17,000 health centers all over Kenya.
The Lions Clubs of Kenya District 411A will continue to partner with the Lions Clubs International Foundation in conjunction with governments and other organizations to eradicate measles and other diseases from the continent.